Hi, good afternoon or good morning, everyone, depending where you're joining us from. Next slide, please. Welcome to today's webinar, Peer Support Approaches for Healthcare Providers, Innovation, Engagement, and Connection to Enhance Wellness. This is the third in our webinar series, session 3, Peer Support Skills and Competencies. Next slide, please. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC. We're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy, and I'm the project coordinator of the center, and will be facilitating this webinar today. The MHTTC is funded by SAMHSA, the Substance Abuse Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. We ask that you please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. And if you're interested in staying up to date with the events and products that the Northeast and Caribbean MHTTC is providing, we ask that you please sign up to receive our email communications. You can do so by signing up at the bit.ly link providing on the screen. Next slide, please. Following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted on our website along with the presenter slides within the next several days. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. We ask that you not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. Again, this presentation will be recorded and posted on our website. At the time of this presentation, Marian Delphin Rittman served as Assistant Secretary for the Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenter during the webinar by using our chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you. So please use the chat feature to answer those questions, and I'll read them to our presenter. Next slide, please. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. This includes language that is strength-based and hopeful, language that is inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, language that invites individuals to participate in their own journeys, language that is person first and free of labels, language that is non-judgmental and avoids assumptions, and language that is respectful, clear, and understandable, and consistent with our actions, policies, and products. Next slide. Now let's begin our webinar. We have Dr. Peggy Swarbrick with us today. Dr. Swarbrick has worked for over 35 years in a variety of healthcare settings, designing and evaluating innovative peer-delivered models and training programs that promote wellness and resilience. She has created an 8-dimensional wellness model adopted by behavioral healthcare agencies and state authorities across the country. In addition, she has developed a wellness coaching model and a wellness self-care program for a variety of populations, including health professionals. Dr. Swarbrick has published extensively on a wide range of topics, including health disparities, the wellness model, and health promotion approaches. We want to welcome everyone, and I will turn it over to our presenter, Dr. Swartz.
Well, thank you, Cuddy, and thank you everyone for joining us today. In this series, this is the third part of the series that we've been focusing on peer support approaches for healthcare providers. So today I'm going to be really focusing in on some of the key skills and competencies to do the peer support work. And we'll reference the previous two webinars where we did provide some specific details about two specific types of peer support programs. I'll make reference to those, and you can also access them on the website. But today we're going to really focus in on the skill. And we're going to talk a little bit more about and really link into the why, the peer support and the benefits, highlight some of the key competencies that are really essential for this work. Something we call the peer support flow, the encounter of doing peer support, what happens in interactions, and it really a flow that works well, that we've seen really helps people using this approach, and really then hone in on how this model is a strength-based approach. We're going to then move into a little bit more around the communication skills, which are a key piece, and talk a little bit about some of these, the blocks. And then next time we'll go into some deeper, and I'll talk at the end with those things. So today we're going to really lay that land out. And most important, as I go through, what I want to highlight is whether whatever role you have now, or whatever your experience is with peer support, you might be doing peer support already, you might be thinking about it, you could be at all different phases of thinking about peer support, doing it. Just be thinking about all the competencies that I'm going to be talking about, the strategies, and think about how it either can inform your work in the future, particularly the immediate future. I'm going to just really highlight things you can do even right now, regardless of whether you have a formal or an informal program. So to get that started, one of the things I'd like to hear in the chat really quickly is what you hope to learn in that next hour. Like, what do you want to get out of this next hour time together? I have the outline together, but really want to hear in the chat really quickly what you hope to get out. And again, especially how it fits into your work. If you're already a peer support worker, what you would like to learn. If you're thinking about peer support, what could we, and Katie's going to help me see what people are, what you want, so I can really make sure I can tailor this best to your needs. So in the chat, what do you hope to learn during the next hour related to the peer support skills and competencies, and anything about how this fits into your work. So if you can put into the chat now, just really good to meet everybody and see what you'd hope to get out of this next hour, thinking about the different peer support, some of the pieces that I've highlighted here. So Kadi, is there any, we have a couple things in the chat there, I see.
So we have someone saying resources to integrate peer support in our organization, what you've learned, successes and failures and pitfalls to avoid. Thank you for sharing.
Successes, pitfalls, the other was the
and successes and failures and pitfalls to avoid.
Okay, great.
Things to keep in mind.
Okay, yeah, please, those of you, there's a handful of you on, just please put in that, because we want to make sure this best meets your needs, to think about what you would hope to get out of this time together. So, oh, there's another one there, I see. Yeah, we have another.
So what skills do supervisors need to provide direction and support to peer support staff?
So supervisor skills, yeah, okay. Yeah, definitely. So the program definitely, the mentoring, okay, I'll highlight a lot of that. And again, that will be part of even the next time too. I'll be going into a lot more of the supervision piece in the next one, but I'll definitely be highlighting a little bit that today. So please, others that are here, please let us know, because we really want to know. So why the peer support? Why peer support, and why the benefits? I see there's some more there we can kind of highlight, but the mental and physical health toll of the work we do, the work we're doing in healthcare is such important work. And we've known for decades that there's a vulnerability of going into this work that we have, regardless of what our role is. But we've known now with what's happened in the last year and a half, 2 years, close to now, there's been this mental and physical health toll on the workforce that's really elevated this understanding of the value of peer support. So really thinking about the stress, the anxieties, the demands, a lot of the challenges that have been in the healthcare arena, just because of just so many different things that have happened. We've seen this term burnout. You used to hear about it a lot. I used to remember hearing a lot of it. There's burnout in the field. I mean, it was interesting because I didn't feel it a lot in my life. And then it's different ebbs and flows in my career, but it's rampant right now in healthcare professionals and just really physicians, nurses, behavioral healthcare providers. There's a lot of data that's been accumulating, and there's actually lots of really important work on this. I've given some reference at the end that really has shown it has such an impact on the worker, the family, our community and population. It really has had a major toll on the workforce. Really one of the reasons why the 2 programs that we talked about in the last 2 sessions really was why we developed it. So the burnout, what happens with burnout? There's this exhaustion, you feel tired, you feel like you have nothing left to give. We give in the work, we're givers in healthcare. We don't experience the pleasure in our work. I know so many, myself, the pleasure I always get from my work, and I continue to, there's been ebbs and flows. You don't feel that as much. And there's a whole host of physiological system that we see a lot of the GI often. People see that where it hits the gut, like really punch in the gut you feel sometimes, but there's that sense, but it can happen in all body systems can be impacted. And that's really the physical health toll that we want to be paying attention to. The other big symptom of, many more symptoms, but these are some of the highlights, is the depersonalization. You just start to going through those motions. Often there becomes a cynicism or a negative view of things that are going on because you're disconnected there in that detachment. And our sense of accomplishment is often that the work doesn't seem worthwhile, doesn't seem like it ever gets done. There isn't that sense of accomplishment. So people start to feel this. So this is really why it's so important to think about models, which we'll highlight in peer support being one of them, that can really perhaps be the buffer of this. I think peer support should have been around before. Now we know it is. Hopefully it's going to be more, but it's definitely can be something that can help prevent this or help people who are in the motions of the burnout, because we don't want to lose good people doing this work. One of the things we have to remember when there's this stress, this burnout, the strain that we've experienced is that, again, there is resilience when we're under this stress, when we're under this strain, under this pressure, this toll that's been weighing people down, that ultimately in the end, the resilience for most of us or most people is stronger than many of the other areas. There is the distress. It starts to affect, those burnout symptoms I mentioned, as well as other things that start to get affected, like sleep, all those physical, physiological, or mental health signs we see. There's the distraction. It often can lead to diagnosis, mental health, substance use challenges. It does lead to that sometimes, or those are sometimes coping skills people use. And, other health behaviors that are often the coping we use to deal with some of that burnout systems. But ultimately, resilience is really strong. And that's what we always have to remember. And that's really where the peer support piece I'm going to talk about, the competencies, come in. Remember that we want to build on that resilience, and people who do have that resilience. So typically now you're seeing a lot of interventions being used to address this historically and just recently. This is a really great paper that I'm going to reference, and it's in the back, called Healthcare Provider Burnout. It was a scoping review. It's a really nice one, but it really kind of highlights a lot of, you see all these self-care programs coming about, things like mindfulness, using CBT, highlighting the importance of exercise, physical activity. Yoga is a big one. And again, there's also those individual self-care programs that many of you may have participated in, or you might be doing them, as well as there's a whole host of work looking at system level factors to ensure a positive workforce, ensure a favorable work conditions to improve the workflow, the work experience for the workforce. So these interventions. So in the work on this, again, there's always the focus on the resilience that we want to always keep in mind why we have peer support, why I think peer support. You can go to these workshops. Sometimes there's communication skills, things, and sometimes in terms of the workforce environment things, there's understanding the value of team approach, teamwork, debriefing, proper sessions that can be provided to staff, stress management training. These are the whole host of types of interventions or strategies that workplaces have. But what we know strongly and we've seen is that a peer support is really an important one that can really needs to be added in here. And again, also the focus, what I like here is on the wellness, because the peer support focuses on the wellness. So laying just the case that this is what we're dealing with. These are the types of programs. And it's nice to go to a yoga thing or go to things, but that doesn't work for everyone. Some people just get turned off by that. A lot of people do like it, but sometimes people don't. You can't always meet everyone's needs. So it really becomes challenging for agencies or providers to do something that really works for everyone. So that's really why peer support can be so important. And I'm going to highlight these competencies, whether you develop a formal peer support program, an informal peer support program, or some of the strategies I'm going to share, you can just bring to your own work unit. I encourage you to think in that way. If your agency can hopefully support this or pilot something, or develop it, but you could also bring these strategies to your work and to your colleagues. We talked last time in terms of the peer support that we did. We talked about the colleagues involved in reaching colleagues through listening empathy, the circle groups. This was a form of peer support that we presented on back in November. And we talked about offering, again, it was more of like an intervention, but it was a very strong peer support intervention where peers, physicians and scientists got together over the course of 6 months. They met twice a month, either through a text asynchronous approach, or they met through Zoom together, and they had discussion prompts focused on health and wellness and work-life balance topics. And they met together and talked and provide peer support from that to get one another. And we've had really good feedback on this program, and it's continuing, and we actually have some good outcomes even on the benefits that it's impacted. So that's just one form of peer support. The other one that really aligns with what we're talking about today, the peer support skills, is the peer support. We trained physicians and scientists on one-to-one care, colleagues aligning to respond with empathy, and they provided peer support. They're available. It's more informal peer support. They're not paid. They're trained to help their colleagues, and they were taught many of the principles I'm going to talk today and next week. But it became a model that could really be available to help provide that peer support to someone who might look like they're in that burnout stage, or the person's in the burnout stage, can reach out to the person. These are two examples of models, the circle groups or the peer support, providing the peer supporters trained and providing the peer support to one another. And that these were two different models. And again, if you're thinking about how do I talk to my administrators about this, or my supervisor about this program, just share this information, share some of the papers around this. And you can reach out to us to get some of the technical support around how do I start a program. But again, what is peer support? What is the peer support that we did offer in and train peer supporters? So the peer supporter, as we know, provides that connection, provides that hope, provides that skill, that listening ear. And it's a really, really important reciprocal way of connecting with people. And it's can be really transformative and healing. And it really provides this connection through as a peer support, as you're trained and you're mentored and supported to provide peer support to someone else, you can really help connect from the heart, correct from the mind, correct from the heart. You're really there to provide a heart to heart, colleagues aligning with empathy, as our program was called. You have a similar experience. You're in the same role. You may have the same vulnerabilities. You're there to provide that listening ear to someone else. And it really, really can be very powerful. There's in the models of peer support, I'm talking more about unpaid peer support, peer supporters, workers. There's a whole host of peer supporters doing things for people in addiction, cancer treatment, mental health. There's a whole workforces out there doing this peer support work. And they really are using a lot of the competencies I'm talking about for today, where this might be in a more of an informal or program, but it's really because you're there because of the shared lived experience. That peerness being based on that shared role, on that shared experience. And it's that vulnerability in that role. You are a physician, you are a mental health provider, you are someone doing certain work, you are a peer supporter. You have that shared role, but you have vulnerabilities, that vulnerability to that burnout that I mentioned before, as well as a whole host of other vulnerabilities, depending on the kind of work you're doing. But you come together, you connect through this reciprocal basis. It's not like I'm a peer supporter, I know more, I'm further along, better off than I have the same vulnerabilities, but I'm aware of them. And I'm being mindful of using these communication skills in this resilience focus to help be here to provide the listening ear, provide my eyes to kind of watch and see what I can do to help you, and really listen from my heart. You're in a peer, so you have that similar experience, but you're there in a way to really listen in a different way, connect in a way that you can really help that person. Sometimes it's just vent and listening and not telling them the answer, but it's there to listen and support and build that resilience, help them to shine the light on the resilience or see the resilience for themselves. So again, peer support in that shared role. You're there often sometimes to provide that knowledge and experience in that connection, as well as some type of the support. And we categorize support into three ways. There's emotional support, which is quite powerful. And probably for many, the really important one is that emotional connection and that emotional feeling of someone hears me, someone's listening to me, someone cares about me. Big piece. And that's really where, when you think about your skill, that's where a lot of your body language, a lot of your listening skills, your reflection skills, your responding skills, and you're being silent and opening up your ears, eyes, and heart to really listen can be so powerful. Learning how to just keep our mouth shut sometimes to truly listen, and then only respond when we can do so in a way that really reflects the person's experiences or helps to listen more to the story. There, as part of peer support can be the informational support we provide. There might be peers where we provide information to people in a way that could be helpful depending on their situation. The practical support sometimes, and that's really sometimes where we might be aware of resources, especially if a person's in an imminent situation where they may need further along support. That could be something that you could provide. So you really provide this information, emotional, practical, and depending on an encounter, it could be 1, 2, or 3 things. And sometimes depending on the phase of your connection or relationship, maybe the emotional helps is in the first time or not, but it's variable. And that's part of the whole peer support too, is you want to be unique in delivering the peer support, is being able to really tap into where that person is. And the context of it, in most of these models that I'm highlighting today, it can be just on the spot, being there, noticing and sharing, going up to someone, opening the invitation to the dialogue, or you could be known in our circle, in our one-to-one care program. It was known who the peer supporters are, so people could know how to reach out to them. So if you're someone thinking about starting this kind of program, you want to know who the peer supporters are. train them. That's part of, they learn, they get trained, they get mentored, and then letting other people know that they're available to be able to schedule that. I wanted to highlight the types of support again, the way that emotional piece, which is that that piece that really can help people feel valued, a really, really important piece, that emotional support piece. And that's something that we learn and refine and develop over time. So you don't just go to a training and get trained in peer support. You learn some of these basic skills, but mentoring, getting supervision and support in some way is so essential to make this work effectively. So if you're thinking about starting a program or you're doing the peer support, you as a peer supporter need to do your own debriefing or have your opportunity to get that support, whether it's through your, what we did in the one program is we had regular check-ins where people could check in. We had check-in times and people dropped in and we did a little bit of a check-in on how things were going, debriefed some of their situations so they could hear from each other what was happening. And then we got feedback on like skill refreshers that people felt they wanted a little more help. Yeah, I really have to remember about those blocks. I have a lot of those blocks. So we refresh the blocks, or we would have a focus on just different topics around self-care and resources. So there's the emotionals, there's the practical support. Again, that's also really the piece too. In the debriefing that we did was we started to arm the peer supporters with more knowledge of resources around the informational peer support that they can provide or that's available, as well as the practical way to connect, because the piece that's different in the support, what might be different, say, from case management type work versus peer support, is it's not doing for the person, it's empowering, and either side by side or with, or it's empowering that person. There might be a chat that came up. I'm not sure if that might be related to something I said, Kathy, that I could answer that question if that.
Or it was a
Yeah.
comment that there has to also be a basis of trust.
Yes, that trust, actually. See, yeah, there is the trust in that emotional, and that's going to come part of the flow. You as the peer supporter have to gain that person's trust, and there's a way to do that, because you're not going to be able to provide that emotional support unless you have that trust. And there's ways to build that trust that you can do. And we find it can happen quite quickly, but you as the peer supporter have to really be mindful of your how you're approaching someone, how you're engaging, how you're supporting. That can really be helpful. Thank you so much. And please feel free, comment or questions as we go along, because I want to make sure this is most useful to you in your work. So the competencies. So, you're doing this peer, we know what the peer support is by definition. We know it can be delivered in different kind of contexts. There's these 3 types of peer support that can be happening in a counter or over the course, but there's just the competencies. What do I need to be competent in to do the peer support? And what you're going to see from this list and from this things is, again, it's all good things healthcare providers get trained in, probably regardless. I teach, I've taught psych rehab students, I've taught occupational therapy students over the decades, and many of these are skills we teach the students: good communication skills, good strength focus. So you're going to notice there might be skills you already know if you're in the if you're in occupational therapy or any of the therapies, or if you're in psych rehab or social work or things. These might be things you're already doing. But again, what you do as a competency, the key one, is engage in that support. So you have to initiate that contact, or the person reaches out to you. And, give them, again, you're going to see in the flow, you got to orient them. I'm here for X, Y, Z. Define what your role is as a peer supporter and convey to them, I'm here to listen to you and support you and not judge you. That's a big piece you're going to see. Initiating that, and then really listen careful attention to what they're saying. And again, you want to get to that emotional support. What's the emotion being communicated? And one of the things that I see, again, when someone wanted to hear about pitfalls, is when, especially when we do the training or I do some mentoring of people or peer supporters often think they'll let the person talk for a few minutes and then, or maybe even a minute or two or three. And then they feel like they have to just give this answer, give this answer, give this answer. And it's like, no, stop, listen more, listen more. So it's just really trying to stop that knee-jerk reaction that I want to now interrogate the person more with questions or get to the root problem of this situation that they're talking about. So you have to really learn how to keep your mouth your lips, closed there, and keep your hands clasped or something. I know myself, I clasp my hands, shut up, Peggy, don't say anything, listen with your ears. That's going to really help you to engage. And then demonstrating that acceptance and genuine respect, being aware of your body language and your response, and having your responses that you do give, minimal responses or reflective responses that really show that genuine acceptance and respect, especially when they're talking about very difficult situations, like validating what they're saying something that demonstrates you are really hearing what they're saying and you're connecting with the experience and the feeling that they had. So really the competencies of engaging the person in this supportive relationship, so important in this. And it happens again through that engagement. And this gives you just a simple flow of it. It's that engagement, going back to, initiating and listening with careful attention, listening, spending time to respond in a mindful way that shows you've listened to the content and the feeling and perhaps the meaning of this all. It takes a long time before you can really understand the meaning of this situation that someone might be conveying to you, but understanding those feelings, understanding the meaning. And then a lot of times it's just exploring and not it's open-ended questions, using those really communication skills that you learned probably in 101 courses that you took to be an effective healthcare provider. So really going back to those communication skills that you did and thinking about again, and then I'm going to highlight a little later as we go, the blocks. That's the biggest thing that gets in people's ways too. And that's why when we do the training and we do the mentoring, we really focus on the blocks. We all have blocks, and I'll do a thing towards the end. I would like to hear what you, as we get closer to the end, I'd like to do a little blocks exercises just to see where you are with your peer support skills and your blocks, but become aware of the blocks and know we all have them. It's acknowledging them and then starting to be more mindful and attentive to that's the time where we close our mouth or we listen, open our ears up a little bit more, but knowing what our default blocks are. And as I show you the blocks later, the challenge of the blocks is so many of the blocks relate to the value of you being a peer supporter, because sometimes people get over identifying with someone. That can become the block when you get to become over identifying with people, and it becomes the block. So, and again, you're identifying with them because of the shared experience. So it becomes this challenging because the content of what you're hearing often is so your experience or a similar experience or a really challenging experience you've had. So you have to kind of reset yourself and, reflect that you had that experience, but then it's listening to their experience. And again, with the communication, it's like listen deep, that deep listening, which is so powerful. And that's what we hear from so many people is really the benefit, that someone really listened deeply with me. So if you can master that skill, it's going to be a wonderful skill to have, and to then be able to, support other colleagues with that. It's a listening. I love this one, with your eyes, your ears, and your heart. I think that is really deep listening can be done. And we all have, we can see or we can hear, or we can connect on that heart-to-heart lesson. And if you can be thinking about that in your interactions, that you're really trying to listen at all those levels, it's going to really help you deepen your connection with the person and try to it will really perhaps be the way to be able to truly understand what's going on, and then help that person to navigate through what they need to do, or or what they maybe don't need to do. Maybe it's just a way for them to help have someone to talk to get this out. And that in of itself helps a lot of people. And this is just another one, seeing with the what you really do when you do that is you learn how to see with the eyes of another, listen with the ears of another, and feeling with the heart of another. And then that deep listening really helps convey that empathy, which so many people say is important, because one of the things that people do say, because you saw earlier in the burnout slide, is the aloneness that people, the isolation that people have. And that empathy is really gives that healing message to people, or helps create that healing that I talked about earlier, and helps people, for many people, know that they're not alone. So that's the first one of the competencies I wanted to highlight. Again, we're going to go through some of these here and then a little bit more next week, trying to break it down. Sharing experience is another important competency. And this is definitely one that I do a lot of help with people to understand what are the experiences we share, what do we don't share, how do we share it. There's art to this practice of sharing, learning how to relate your own experiences with permission, or with the right timing to help with that connection, and perhaps sometimes normalize. But it's not like going there to tell your story, but it's finding the ways that you can tell snippets of your experiences that really helps the person know that you have been there or you've experienced something similar, and that really helps with a strong connection. Often and this is where some people, especially in healthcare providers, historically has gotten a little different. What are our ongoing efforts to it? And that's something that we're all working on. And those of us working on ongoing efforts for our own self-care, sharing those if you're comfortable. But that's something too, where the mentoring and supervision will come in when you're doing peer support, is to get that support around what is to share. Or I always think about it that if the Band-Aid's still on and the wound is not totally healed from myself on something or on a situation, it's just not the time. And you learn how to know what are the things to share or not. And that evolves for people over time. So it's learning how and recognizing when and where to share. I see there might be another question or comment, Kadi. I didn't want to stop before I move to the next slide.
It was my comment. I was asking the participants to please feel free to share their comments and questions.
Okay, great. Thank you. Feel free to comment if there's anything I'm saying that you want me to stop a little bit, because I have so much. This peer support is so important. This work, it's just so much to share in this short amount of time. So hopefully this is a good primer. And if you want more, I can share, and maybe there's other things we can get you to learn to, go to further training. So, really, again, the pitfalls, the things people asked about, what really, when you are a peer supporter, what I've seen really people be great peer supporters, and I've seen people, it's just probably not the best match for them at that time. Not saying ever, but when people are just trying to just do this analysis and start doing the judging and starting to get into this fact finding from the situation, that's doesn't work for people, shuts people down, it turns people off, and then it puts you in this expert mode, and it doesn't help the person build on the resilience that we know that they have, that we saw earlier on. You want to share things that really, again, when you're sharing, this is part of that art of practice, is that you express that empathy, but not taking away the focus. So it's learning that art of that. And again, that's the biggest thing that we find for everyone, is to try to avoid fixing the problem for people. So just being able to try to think, I'm going to solve this problem as a competency. You're not there to solve, you're there to listen, let the person connect with the person, express, and then perhaps help them to start to figure out their next step, or their not even next step. That sometimes it's the serenity statement. It's helping people to understand and internalize the serenity statement. I can control certain things. There's certain things out of my control, and I have to learn the best to know the difference, and have that wisdom. So again, some of the pieces here, in terms of personalizing the peer support, that's the other piece too, because we have the similar lived experience from the role, from the vulnerabilities, but we also have differences. We are different people, which is good. It's okay. So you want to be there to make sure you're personalizing it to the individual and not starting to share things because on your biases or only your experiences and your beliefs about things. Like we see this a lot where people believe something's right or wrong and they hear somebody talking about it. Well, don't do that because that's not good for you and those kinds of things. Those kind of statements you want to stay away from. You want to listen to it and then understand why that might be the step that person's talking about or the coping skill they're using. I see that a lot with people who, are doing peer support and they see people who might have different addiction kind of challenges and people start to really get into judgmentalness around, people's use of different substances, and you have to be very, very, very mindful of that and be there to really understand that everyone's experience is different. People are sharing things that are quite difficult, but we want to be avoiding that judging piece and trying to be able to bring in our biases into the situation. Really, the listening to the person and understanding them truly is a big piece of this. In terms of the flow with the another piece to this is helping to avoid, manage, prevent crisis. And the next time I'll go a little more detail into this, but there is some training around really, okay, you're in the encounter, but you really see the person's in a distress, knowing those steps to take and knowing what the resources are available within your facility or institution or the policies and procedures when you need to maybe get to the person to a situation to make sure that they're safe or they can really know that they need another step that's beyond the peer support that you're providing, creating that space, safe space, but knowing when to help link the person to other kinds of resources and also really spending that time to discuss their coping strategies and their self-care skills. And that's really why that's so important in the peer support encounter. You're providing the information again is a big piece of what we talked a little bit about and helping those accessing that information, kind of going back to that. I'm going to move a little in terms of the flow. It's that presence. You want to make sure you're not distracted, always leading with the strengths and highlighting the narrative when possible. So when you're orienting someone to a model, so you're thinking, okay, what is peer support and what I'm here to tell you, you want to always let people know I'm here, I'm trained as a peer supporter and peer supporters. This is why I am trained and this is what I'm doing. You always want to try to highlight for them your role and the scope of your, work, whatever it is, whether you're, however this peer support is being delivered in what context, but making sure that you're making clear that it's reciprocal. I'm not here to be telling you what to do. I'm here to be listening ear, and I'm here to help. I care about you and I care about your wellness. So focusing again back to that resilience, that strength-based focus is a major competency, the strength-based focus of the work of peer supporters. And with that, I want to highlight the resilience again, keeping in mind the resilience, focusing on that, and also remembering that the strengths, that people have strengths, people have needs, people have these areas. So try to help think about yourself holistic. The person's talking physically, but what about socially or intellectually or occupationally? Thinking of the person as a whole and helping them to start to see themselves, that they might have these challenges in their work, whatever, but when you really start to talk to them, you might start to hear physically, environmentally, they have some strengths, or socially, they have some strengths. They have a problem for sure. They're going to have 2 or 3 problems, but if you really have a good dialogue with them, you're going to start to uncover the strengths. And the wellness kind of a framework or the resilience model helps us to think beyond that. There you see the overlapping of the circles, and people truly are more than just this problem they're presenting. They have all these strengths and they have all these needs. So through your dialogue, you want to tap into that. I will, as a resource, a little inventory to learn more about wellness if you wanted. I just put that in as something you can go back to if you want to learn a little bit more about the wellness model if you don't know, and how to use that in the peer support. Finally, before we get to this piece of this part 1 of today, today I'm highlighting these different competencies. The last one I want to highlight before I just give some practical strategies you can take away today, whether you have a peer support program or not, is the blocks to connecting and effective engagement. So I'm going to mention these briefly, and then again, I want to see in the chat if you have any questions about the blocks and what your block is. So the blocks to listening, these are the things, because we said, communication, engagement, and a supportive relationship is so important. So you're going you're in your communication skills, but blocks come to us listening. We become distracted. Again, that's why you want to minimize distractions going in. So many distractions, they can be external distractions or they can be internal distractions. So being mindful of the various distractions that we might have internally in ourselves or externally to us. The comparing becomes one that often for people start to compare themselves because the situation is so similar. Judging one, again, that gets back to that one about personalizing peer support. The judging piece comes in and then we start to judge and then we don't hear fully. These are all host of them: filtering, placating, advising, identifying, rehearsing. That happens especially when you're learning it new, because you want to say the right thing and you don't want to hurt anybody, or you don't want to, say the wrong thing. So I just want and I've given you a detailed description of these, but you got a general sense of. I'd like to see in the chat, what is the block that you find that you would say, for example, you're going to have a training on peer support for yourself. What would be the block you would like to get the most help with? What would be the block that might get in the way of you doing peer support? So if you can post in the chat, just take a look at it. We'll take a look at which blocks the folks here, we have, there's a handful of you here, probably about 14 people here. What's your blocks? Want to just hear what block you may have that might get in the way. So yeah, we have a couple here. People
We have judging, comparing, mind reading and advising, comparing, placating, identifying.
So we have a lot of different kinds of blocks that people are aware with, that you do have. And thank you for putting that in there, because you just recognizing is it the first step. And that's what we do in the training, is just, okay, what is the block? Being aware of the one that perhaps we might most default to, because it's often a default, and it's probably related to a strength you have, for sure. And the strength of the peer support, as you can see, so many of these blocks relate to why peer support is important. You have a similar experience, so you might be comparing on some level. That might just happen automatically. So just be mindful of that. And the piece to the strategy for working on that is just being mindful of it and then starting to work through it and starting to notice it as you're in encounters and being more mindful of that, and then discussing it with, processing it for yourself or getting some feedback from others. When we do a lot of role plays in the training that we do. So we do a lot on this in the trainings that we provide. So, if you are doing peer support already, just and you're going to be doing this, like in your trainings, do some role plays with another so you can get some feedback. And also you can start to practice that. It looks like someone else might have put another one in there too.
Yes.
Or question.
So advising.
Yeah.
Advising is one, and I'll share one. It's always listening to respond or already coming up with a solution for them. Yeah.
And you're rehearsing it like in your head. So like, how is your heart? How is your heart, your eyes and your ears listening when you're rehearsing, right? So like it gets in the way, and but it's not beating ourselves up, just understanding we have the good intention of wanting to help someone. So yeah, it's just such an important competency. As some of you had said, you wanted to know, okay, what are some of the things? I'm going back to my notes to see what, make sure I cover what people asked here. You would like to know the supervision around that. This is where supervision can help support someone. And again, the pitfalls of doing the work, the blocks are the biggest pitfall, and not developing the competencies around the blocks is a big pitfall. Or that would prevent the success of people doing the peer support or an effective peer support program. So, I'm just being mindful of time, because the second part of this, I'm going to go into a deeper dive on a couple of other competencies. The other set of competencies, we wanted to divide this up into two parts just to make sure we're not overwhelming and you can digest what I've said and have time for questions. So I just real quickly, before I have two more things to just walk away from this, but what, and I'll just show you what I do have. This is this is part 2 we're going to go over. We're going to go into some of the listening skills as it relates to the strengths in supporting the self-care. We're going to go into deeper dive on that next time. We're going to talk a little more about how we linking people to resources a little bit more deeply. And then the other piece I'm going to do towards the end is, like, regardless of with this peer, so how can you become a champion in your workforce, whether you're formally in this role, or how could you become an informal champion to help maybe create more peer support programs in your workforce. So I'm going to go into those kind of things for the next time. But before that, any questions before and you'll see I gave you some details on it in the PowerPoint here, what of different blocks. But what questions do you have before I have a few parting words, like about questions about the core, why peer support, the defining it, we went over that. As well as we went over, some of the relates, why the important need and the urgency of it with the burnout and the healthcare challenges today, and then just these core competencies, the successes and pitfalls. I think, as someone had asked, training people, developing a formalized program, letting people know that really helps with the success. The pitfalls are not giving it enough support and attention to the training and the support of the people doing the peer support work is a big pitfall, I think, of programs that have not been as successful or perhaps not, continued on. Supervision skills, as a part of what I find the best thing is to have someone who is a peer supporter already, or someone who has peer support training be available to provide that mentoring, or of the supervisor getting that training. So, because it's hard to supervise someone if you don't have the skill yourself. So making sure the supervisor has gone to the training, is understanding the competencies, and can help the staff you're supervising to master those competencies and mentor them, or finding them mentors is another way some agencies have done it when the supervisor may not have the skill set themselves. But any other questions before I go to the last two parting thoughts for today? Perhaps we could either, if you have a specific question, unmute you, or we could post the question in the chat that I can share, by today, and then, next week, and especially even if something you want further covered in the session next week.
At this moment, I don't see any other questions, but I'm sure maybe you might come.
Well,
Yeah.
the other thing that I can say, and regardless of what you do in peer support, we've gone over, you probably can hone in on these skills, focus today, just in the next week, what you can do to connect, because connection is it, whether you're doing peer support already or you think, just connect with two coworkers and just see how they're doing. How are you doing? That's a good way to start if you're doing that. And again, either those coworkers or another coworker, one of the things that we can do in the workplace as a peer supporter is, just telling our coworkers we're thankful for them. I think that's going to help create a culture of peer support in the workforce using some of these competencies. And or for some people, it's just, perhaps sending the motivational text to a coworker or a family member even too. That's just something to think about. So those are just some parting thoughts about how you can take some of these skills in here from what we talked about today. And, hopefully, there is peer support that we want, you're going to continue, and I gave you some resources here. Definitely, we have the questions. I definitely will want to see if there's any kind of other feedback or I do see there's some Q&A.
Yes.
How can
Mhm.
How,
So we have a question in the Q&A pod. How can you identify another person's resiliency?
so it's a lot of times it's listening to what they're saying. And sometimes we find like resiliency is, the person's explaining something that's so challenging, and then it just hearing the strength that they had to deal with that situation and understanding that they've been enduring this. It's like reflecting back to them the strength that they've had of dealing with that, as well as perhaps the resiliency of them even reaching out and talking about it is a resiliency. So it's just being able to hone in on those, what might seem small, but they're really powerful things people are saying, or pieces of the story they're sharing are powerful messages of the resiliency people have. So I think that is, it just really listening and reflecting it to the person and sharing back and validating them is a way. And again, when we really open our ears, hearts, and our eyes to listening deeply, the resiliency starts to shine strong, and you see it overweighs the other risk factors or the potential for people developing more severe illnesses, but that's a great, great question. So let's see, we see any, but okay, yeah, we have different people, any other things, yeah. Please, share anything that else for the next time, but the next time, as I said, we'll be going over the further competencies around the listening, further competencies around the linkages, how to do the linkages, working on the linkages, and further strategies on becoming that champion in your workplace, because it will be contagious if you can become that champion there on your team and your program. And hopefully the agency you're in is supportive of this or wants to start to expand this program. So it can, and again, I think regardless, we need to just have peer support programs for the healthcare workforce, and it needs to become an essential piece of this strategy. As I saw, you saw the paper, the scoping review that I referenced in the beginning. We need to really show that a peer supporter program needs to be there, not just now post-COVID, we're not post-COVID, but during this period, for ongoing. And and what I kind of see, which is so interesting with this, it's the lemons and the lemonades, is I think that the idea of the peer support, which was always this fringe kind of thing, we are just getting ready to show where peer support can shine a light on really helping the quality of life of so many people in our workforce, this longstanding problem with burnout. So there's some new niches, I think, in our field for people who want to do peer supporter work to try to really help keep a really strong, vibrant workforce and use these core skills that we all as healthcare providers, many of them, are trained to begin with. But again, but we really want to thank everybody for your time today and being part of this series. Again, the two previous series gave the two examples of the programs, the circle groups and the one-to-one care. So you can access those if you want to make reference to those specific programs. And we'll hopefully see you next week to go into a deeper dive on the peer support competencies part 2. And want to just thank everybody for your interest in peer support and the good work of, whether you're doing it already or you want to continue to strengthen it in your work. We definitely want to thank you for that, and looking forward to next time.
Thank you so much, Dr. Swarbrick. As Dr. Swarbrick mentioned, we will host our part 2 of the skills and competency next week at the same time. I will send out registration links for that series. Also, I just wanted to mention that in the chat box, I did share the link, and I'll share it again, the links to the evaluation survey. So if you could please take a moment and complete it. It's short, and this is how we get our feedback. Want to thank everyone for attending today, for actively participating. And of course, I want to thank Dr. Swarbrick for providing us with this webinar today. We hope that you have a wonderful rest of your day, and we'll see you next week. Bye-bye.